Hello and welcome. Today we'll be discussing bladder trauma, a potentially serious condition that can arise from various injuries. We'll delve into what it is, how it happens, what to look out for, and the ways it's managed. Let's get started. So, what causes bladder trauma? The most common culprits are blunt abdominal trauma, like from car accidents, falls, or direct blows to the abdomen. Penetrating injuries, such as gunshot or stab wounds, can also directly damage the bladder. Less frequently, iatrogenic injuries, those occurring during medical procedures like pelvic surgery or cystoscopy, can lead to bladder trauma. Finally, spontaneous rupture can occur, although it is rare, usually in the setting of a pre-existing bladder abnormality or obstruction. Now, let's talk pathophysiology, what actually happens when the bladder is injured. The severity of the trauma dictates the extent of the damage. A bladder contusion, or bruise, might involve only minor bleeding within the bladder wall. However, a rupture, or tear, can lead to urine leaking to the peritoneal cavity, the space surrounding the abdominal organs, or into the extraperitoneal space, the area outside the peritoneum. This leakage causes inflammation and potentially infection. Depending on the location of the tear, other pelvic organs may also be affected. The longer the urine leakage continues, the greater the risk of complications like peritonitis, sepsis, and the formation of scar tissue. In terms of epidemiology, bladder trauma is relatively uncommon, accounting for less than 1% of all traumatic injuries. It's more frequently associated with severe trauma involving multiple organ systems. Pelvic fractures are present in a significant proportion of bladder rupture cases, particularly those caused by blunt force. Men are more likely to experience bladder trauma than women, possibly due to anatomical differences and higher rates of participation in high-risk activities. What are the signs and symptoms to watch out for? Common indicators include hematuria, which is blood in the urine. Patients may also experience abdominal pain, tenderness, and difficulty urinating or being unable to urinate at all, depending on the severity of the injury. Symptoms of shock may be present, such as a rapid heartbeat, low blood pressure, and altered mental status. With extraperitoneal rupture, pelvic pain, pain radiating to the shoulder, or thigh pain is possible. It's crucial to remember that not all patients with bladder trauma will exhibit all of these symptoms, and some may have delayed onset of symptoms. Diagnosing bladder trauma involves a combination of physical examination and imaging studies. A thorough physical exam will assess the patient's overall condition and identify any signs of abdominal injury. Urinalysis will confirm the presence of blood in the urine. The gold standard for diagnosis is cystography, a radiographic study where contrast dye is instilled into the bladder through a catheter. X-rays or CT scans are then taken to visualize any leakage of contrast outside the bladder. CT cystography is preferred, as it provides better detail and can identify associated injuries. In some cases, cystoscopy, a direct visualization of the bladder using a small camera, may be used. Bladder trauma can be classified into several types. Bladder contusion is a bruise to the bladder wall without any full-thickness tear. Extraperitoneal rupture occurs when the bladder tears and urine leaks into the tissues surrounding the bladder, outside of the peritoneal cavity. Intraperitoneal rupture involves a tear in the bladder wall and urine leakage directly into the peritoneal cavity. Combined ruptures involve both extraperitoneal and intraperitoneal components. The severity of the rupture can also be graded based on the size and location of the tear. Treatment for bladder trauma depends on the type and severity of the injury. Bladder contusions often require only supportive care such as pain management and monitoring. Extraperitoneal ruptures can sometimes be managed conservatively with catheter drainage, allowing the bladder to heal on its own. However, surgical repair is often necessary, particularly for intraperitoneal ruptures or complex extraperitoneal ruptures. Surgery typically involves suturing the bladder tear and draining the surrounding fluid. In cases of penetrating trauma, exploration of the abdomen may be required to address other injuries. Post-operatively, a catheter will remain in place to allow the bladder to heal. Antibiotics are often administered to prevent infection. Preventing bladder trauma primarily focuses on preventing the injuries that cause it. This includes practicing safe driving habits to reduce the risk of motor vehicle accidents, using appropriate safety equipment in workplaces and during recreational activities, and taking precautions to prevent falls, especially in the elderly. Ensuring proper surgical technique during pelvic procedures can help prevent iatrogenic injuries. The prognosis for bladder trauma is generally good, especially with prompt diagnosis and appropriate treatment. Most patients recover fully without long-term complications. However, delayed diagnosis or inadequate treatment can lead to significant complications, such as peritonitis, sepsis, or bladder dysfunction. Research continues to focus on improving diagnostic techniques and surgical approaches for bladder trauma. Minimally invasive surgical techniques, such as laparoscopic or robotic repair, are increasingly being used to reduce recovery time and improve outcomes. Further studies are also exploring the use of regenerative medicine to promote bladder healing after trauma.